working moms and dads awake at night. And Nyla Payton is one of those working parents. Nyla lives with 3 children in Pittsburgh in the working class African American community of East Liberty. It's a neighborhood that developers are trying to rebrand as the village of the East Side as they gentrify it. As her neighborhood gets pricier, Nyla works hard to keep her family afloat. She's trying to make it from paycheck to paycheck with a job as an administrative assistant in the pathology unit at UPMC Presbyterian Hospital. Her hospital is part of a gigantic system called the University of Pittsburgh Medical System, a health system worth $19 billion that operates 40 hospitals and 600 clinical locations. More than 85,000 people work there. UPMC dominates Western Pennsylvania's hospital market, and in the late 1990s, several Pittsburgh hospitals merged to create UPMC. And then they acquired and merged with competing hospitals across 29 counties in Pennsylvania. Many Pittsburghers will tell you that the location of UPMC's headquarters symbolizes its power and influence over their community. UPMC now occupies the U.S. Steel Tower in downtown Pittsburgh. UPMC's rise to market dominance is a story that you all know better than I do, that's being repeated in many places across the United States. Heather's new book cites research by Lemore Daphne, Robin Lee, and Kate Ho that shows how hospital mergers are driving prices up for patients. That dominance in the market creates problems for workers too. UPMC's domination of Western Pennsylvania's hospital market gives it something close to monopsony power over the labor market for hospital workers in the region. Nyla has worked at UPMC for almost 14 years. She says she enjoyed her work at first, but she soon got frustrated with feeling stretched thin because of short staffing. And on a school bus, when I met her at UPMC Presbyterian and she joined me to go to the next hospital because she was on strike that day over the short staffing and her wages, she shared with me something that no worker should have to go through in this nation, that she's developed embarrassing bladder problems because she's required to cover her position for such long stretches that she didn't get regular bathroom breaks. She's also gotten frustrated with how expensive it is to care for her family with the health care coverage that UPMC requires all their employees to participate in. I know it's hard to believe, but Nyla is in medical debt to UPMC, like 60% of her service and tech coworkers. They're in debt because it costs so much to get care at the same UPMC hospitals that only keep their doors open because of the work that they do every day. Nyla is a leader in the campaign to create a check on UPMC's power. She's a leader in a union for UPMC healthcare workers. Since 2011, UPMC hospital workers have been organizing to get a seat at the table so they can negotiate to get paid enough to keep ahead of their monthly bills. When fast food workers in Pittsburgh joined the growing Fight for 15 and a union movement, in 2013, UPMC workers linked arms with them. Fast food workers and hospital workers stood united to call for the $15 wage floor and for fast food work and for hospital work. In response, UPMC's Vice President for Human Resources told the New York Times in 2015 that the hospital system could not afford to raise the pay. He said in 2014 that it wasn't realistic to think that every UPMC job could sustain a family. But Nyla and her coworkers believed that's not true, and they didn't back down. They kept marching and striking and fighting alongside the McDonald's workers, child care workers, home care workers, and other service and care workers throughout Pennsylvania who are united under the banner of the Fight for 15 and a union. I'm incredibly proud that SEIU members supported and shared resources with this movement going back to the first time that fast food workers struck in November of 2012. Their collective action challenged and then changed the conventional wisdom about wages and work in our country. They pushed employers and elected officials who call the shots in our economy to finally take action and start to raise wages. In 2016, this movement made UPMC's executives blink. They announced that UPMC will gradually lift its minimum wage to $15 by 2021. This is a step forward, and it's a credit to the courage and determination of Nyla and all of her co-workers who are building her union, but it's not enough. Nyla and her UPMC co-workers still can't negotiate for better health insurance, staffing, or scheduling because UPMC is doing everything in their power to stop them from bargaining as a union. When Nyla and other workers first started their campaign to organize a union, there was huge support across all of these hospitals for the idea. Hundreds of people came together in meetings to discuss next steps. But then UPMC cracked down. It fired, harassed, and disciplined workers who wanted to form a union. Hospital workers tried to assert their right to organize, filed scores of NLRB charges that detail how UPMC had violated their rights. In a 2015 ruling, an administrative law judge found that UPMC, and I quote, because we don't often get decisions like this from the NLRB, engaged in such egregious and widespread misconduct so as to demonstrate a general disregard for employees' statutory rights. UPMC was ordered to make financial restitution to workers it fired in 2012 because they wanted a union. It's 2019, and UPMC has still not paid those workers what they're owed. UPMC was ordered to post a notice and make an announcement to acknowledge to all the people that supported the union that they broke the law back in 2014, but it still hasn't posted that notice either. What's happening to people who work at UPMC is happening to working Americans across our economy. UPMC can get away with ignoring its employees' rights under the law because the law protecting those rights is so weak and the rules are broken. It's almost impossible for working people to organize using today's law. It's especially difficult for people who do service and care work. And that's not an accident. When Congress passed the National Labor Relations Act in 1935, it excluded domestic workers and farm workers and child care workers and home care workers from the right to collectively bargain. Congress kept them out because powerful white lawmakers were dead set on stopping black and brown working people who did these jobs from gaining any power. And over time, corporations have found more and more ways to exclude more people by aggressively fissuring the relationship between lead employers and workers. A growing number of employers in this economy pretend that they have no legal responsibility for their workers or any obligation to collectively bargain. Millions of jobs in this economy have been misclassified, contracted, outsourced, perma-temp, franchised, or turned into an app-based gig so companies can evade accountability when it comes to creating jobs that people can actually live on. Because of this combination of race-based exclusion and job fissuring, our union estimates that as many as 45% of American workers are now effectively excluded from having the opportunity to collectively bargain. All of this precarity produces more profit and flexibility for corporations, but far less security and stability for working people. As corporations consolidate in health, retail, fast food, and other sectors that the people in this room could name, it's too easy for employers to throw up barriers to block workers from joining together in unions. These organizations and unions could act as countervailing power to all that concentrated wealth. And this has disturbing consequences, as we've heard today in the panel on structural power, for the communities that we live in and for our entire democracy. Inequality and insecurity help fear and hate grow. Inequality and insecurity make it easier for some politicians to point the fingers at workers of color and immigrants as the other. This division means that we can no longer take the stability of our democracy for granted. Extremists and forces of hate threaten to make a shambles of our government and our elections. SEIU members and the leaders of the Fight for 15 and a Union movement believe it's time to rewrite the rules. It's time to empower working people to join together to fight for balanced, shared prosperity and a strong, inclusive, multiracial democracy. To do that, our contribution to a much broader movement that's raising many other issues and policy is to fight for unions for all. Unions for All is our fight to push our elected representatives at every level of government to challenge corporations to sit down and negotiate with workers. It's a fight to update our laws to make sure that all working people have the opportunity to join a union, no matter what kind of work we do. Last year, researchers at MIT Sloan conducted a survey that found 48% of working Americans say they want to join a union. But as most of you know today, less than 11% of Americans are in unions. That means that there's another 37% just by this one study, and I know there are many more, that want to be part of a union but are being kept out. That adds up to at least 58 million working people who want to unite in unions but cannot. We think that there are 4 bold changes that would make it possible for those millions of Americans to join together in inclusive, multiracial unions that put an end to work that traps people in poverty. Number 1, the next president needs to bring employers, workers, and government together at an industry-wide bargaining table to negotiate wages, benefits, and working conditions. McDonald's workers have been at the forefront of the fight for 15 and a union since the beginning. But McDonald's corporate leadership still insists that it has nothing to do with how much workers in stores that are operated by franchisees are paid. We believe that our next president should convene a national bargaining table to bring McDonald's, Wendy's, and Burger King together with workers and their union. At that table, they would negotiate job standards for the 1 million direct employees and 3 million fast food workers across the country who are working for other employers. Once a certain number of workers in a sector show that they want to form a union, get a seat at the table, the Labor Department should recognize them. Then the government would invite those workers and employers in their sector to negotiate a collective agreement for basic standards. That agreement would extend across the sector. Employers would have to live up to its terms. This is what the rules are in countries like Europe and Canada that McDonald's, Wendy's, and Burger King actually play by. It stops employers from competing on how low they can push wages down. In countries that currently empower workers to bargain sector-wide, far more workers are included in a process to reach basic agreements on job quality. In Northern Europe, these sector-wide unions mobilized working-class voters to win a social wage that provides health care, child care, parental leave, vacation, and pension support for every working family, whether they're in a union or not. They gained the power to build more equal societies with a higher standard of living for everybody, no matter what kind of work they do. Our goal would be to fight for a new American social wage to create a better way of life for all of us, whether you work at a hospital or a McDonald's or in your car driving for an app-based service. Number 2, states and cities have to be allowed to innovate and find new ways to empower workers to organize unions. States and cities should not be held down by the limits of federal law. Prompted by the Fight for 15 and a union movement and many our allies and partners, cities like Seattle and Washington, D.C., and states like New York and California and Illinois have raised their minimum wages to 15, going above and beyond the pitiful $7.25 in the federal minimum. That these same places in our country should also be free to strengthen workers' right to organize unions above and beyond the minimum rights that we have with federal law. Number 3, everybody who works for the government, for a government contractor, for a private enterprise that gets taxpayers' subsidies should be paid at least $15 an hour and have the opportunity to bargain up from that by getting a chance to join a union. At UPMC, Nyla Payton's employer is nominally a nonprofit organization. By giving UPMC tax-free status, the people of Pennsylvania give this company a huge tax subsidy worth hundreds of millions of dollars. And like all hospitals in our country, UPMC keeps its door open because of our tax dollars through Medicare, Medicaid, and subsidies offered through the Affordable Care Act. Our dollars should not be used by hospitals to fight against their own workers. Our tax dollars should not be subsidizing employers that use their market power to hold wages down. And finally, number 4, every major economic plan, including proposals for the Green New Deal, healthcare for all, college for all, have to create good, family-sustaining union jobs. When we expand healthcare coverage and strengthen it in this country, let's make sure that the 9 million healthcare workers that are either excluded or blocked from joining a union get a chance to get a seat at the table. When we win a Green New Deal, let's make sure that the millions of new clean energy workers can join a union and have a seat at the table. When we win college for all, let's make sure that 2 million higher ed workers on a campus can join a union. We know that this is an audacious agenda. We know that we'll have to fight hard to get it passed, but we believe that momentum is turning and a paradigm is shifting, as we've discussed here today. The leading presidential candidates are listening to working people who are fighting for the power to change their lives for the better. They're responding. Candidates are showing up when Stop and Shop workers strike, when McDonald's workers strike, when GM workers strike, when Chicago teachers and school employees go out on strike. Leading candidates are putting forward detailed, serious proposals for how to strengthen unions. All major candidates have now introduced plans to make it easier for working people to organize. Some plans are stronger than others, but they all make it easier to join a union. For example, Buttigieg, Castro, O'Rourke, Sanders, and Warren have issued plans that fully support giving American workers the power to bargain by sector. Biden and Harris say they will explore how to create sector-wide bargaining in the U.S., with Biden proposing a cabinet-level working group to design a plan in the first 100 days if he's elected. Members of SEIU and the Fight for 15 are bound and determined to fight for unions for all because we believe that this is a fight to decide what kind of world our kids will inherit. We will never be able to build healthy communities on a foundation of precarious, non-union, low-wage work. Many of our parents and grandparents helped build powerful unions that transformed low-wage jobs in factories owned by companies like Ford and GM into middle-class work. We now believe it's our turn. We can and will build a movement to transform service and care jobs, making them the backbone of an inclusive, growing middle class in every part of Canada, Puerto Rico, and the U.S. Our mission is to build unions that empower Black, brown, white to unite across differences and remove barriers that hold people back because of race, gender, or immigration status. And this is not a new goal for our movement. Back in 1946, Fortune magazine published a special issue to predict what life in America would look like after the war. And as Professor Nina Banks was telling us the story of Sadie Alexander this morning, I started imagining her role in making sure that the unions that working people had organized in the 30s and 40s were on the verge of changing the balance of power. That magazine noted that in the South, growing unions among textile, furniture, and tobacco workers were the only institutions where white and black people worked together towards a common goal. Fortune predicted that the day would inevitably come when rising union power would overturn the non-union Jim Crow order in the South. We now know, of course, that that day did not come. Powerful corporate interests and entrenched white supremacists in the South also recognized and fear the power of multiracial institutions. And the anti-union Taft-Hartley legislation was pushed through Congress 1 year later to stop the progress of Southern workers were organizing. With Unions for All, we aim to finish the job of overturning the model of low wages, racial division, voter suppression, and unfunded public service. We will use our collective power to fight for wage-led growth that fuels inclusive, sustainable prosperity for all in the South and in every part of the country. This is the defining challenge of our time. Working people are hungry for a change, and we're determined to work with all of you and the incredible ideas and intellectual content you give us to organize from and to win a future for people like Nyla Payton and for her children and all other working families, no matter what our color or where we come from. Thank you very much. Thank you.